What is coronavirus or COVID-19? Coronaviruses are a large family of viruses. Some cause illness in people and others cause illness in animals. Human coronaviruses are common and are typically associated with mild illness similar to the common cold. Symptoms of COVID-19. You may not know you have symptoms of COVID-19 because they are similar to a cold or flu. Symptoms may take up to 14 days to appear after exposure to COVID-19. Symptoms of COVID-19: fever, cough, difficulty breathing, and pneumonia in both lungs. Transmission of coronavirus: close prolonged personal contact, such as touching or shaking hands. Respiratory droplets generated when coughing or sneezing. Touching something with a virus on it, touching your mouth, nose, or eyes before washing your hands. Prevention of coronavirus: being prepared in case you or a family member become ill, following the latest travel advice from federal and provincial public health leaders, avoiding all non-essential travel including cruise ships, self-isolating and monitoring for symptoms, cough, fever, or difficulty breathing for 14 days if you have traveled outside of Canada, reducing contact with others by following the guidance of self-monitoring, self-isolating, or isolating, practical social distancing and proper hygiene, and wearing masks if necessary. For social distancing, together we can slow the spread of coronavirus by making a conscious effort to keep a physical distance between each other. Social distancing is proven to be one of the most effective ways to reduce the spread of illness during an outbreak. This means making changes in your everyday routines to minimize close contact with others, including avoiding crowded places and non-essential gatherings, avoiding common greetings such as handshakes, limiting contact with people at higher risk like older adults and those in poor health, and keeping a distance of at least 2 arm lengths, that's approximately 2 meters from others. Proper hygiene can help reduce the risk of infection or spreading infection to others. Wash your hands often with soap and water for at least 20 seconds, especially after using the washroom and when preparing food. Use alcohol-based hand sanitizer if soap and water are not available. When coughing or sneezing, cough or sneeze into a tissue or the bend of your arm, not to your hand. Dispose of any tissues you may have used as soon as possible in a lined wastebasket and wash your hands afterwards. Avoid touching your eyes, nose, or mouth with unwashed hands. Clean the following high-touch surfaces frequently with regular household cleaners or diluted bleach, that's 1 part bleach to 9 parts of water, like toys, toilets, phones, electronics, door handles, bedside tables, or television remotes. If you are a healthy individual, the use of a mask is not recommended for preventing the spread of COVID-19. Wearing a mask when you are not ill may give a false sense of security. There is a potential risk of infection with improper mask use and disposal. They also need to be changed frequently. However, your healthcare provider may recommend you wear a mask if you are experiencing symptoms of COVID-19 while you are seeking or waiting for care. In this instance, masks are an appropriate part of infection prevention and control measure. The mask acts as a barrier and helps stop the tiny droplets from spreading you when you cough or sneeze. Merci beaucoup!